Welcome, everyone, to this explainer. I am absolutely thrilled to be your guide today as we put on our detective hats to solve a super common yet wildly misunderstood medical mystery. We're going to break down the facts and completely demystify a highly contagious skin condition known as impetigo, or as it's known in Vietnamese, baint choke. Whether you're a parent, a teacher, or honestly just someone fascinated by how our bodies battle microscopic invaders, you are exactly in the right place. Let's crack this case together and make sure you walk away with a crystal clear picture of what this disease is, how it operates, and exactly how to stop it in its tracks. So let me hook you right from the start with a question. What do you think is the most common bacterial skin infection in children? Picture a mysterious rash that suddenly sweeps through kindergartens, elementary schools, and summer camps. One day, a kid just has a tiny red scratch, and literally a few days later, it's a spreading, crusted lesion. It is the ultimate playground plague. Well, the answer to that question is exactly what we're investigating today, impetigo. To solve this case, we've got a quick roadmap. We'll be covering 1. Tổng quan và bệnh chốc. 2. Điểm mặt vi khuẩn gây bệnh. 3. Dấu hiệu nhận biết bệnh. 4. Các biến chứng nguy hiểm. And 5. Điều trị và phòng ngừa. All right, jumping right into section 1, tổng quan về bệnh chốc. Before we can defeat our microscopic enemy, we've got to know what it is. Impetigo is a highly contagious, superficial bacterial infection of the skin caused by gram-positive bacteria. And what's super important to note here is the environment it absolutely loves. This infection thrives in hot, humid climates. Think tropical regions, or, those really sweaty, sticky days of summer. It spreads through direct contact, just touching the lesions or sharing towels. And while it can technically affect anyone, it definitely targets kids, usually sneaking in through a minor cut, an insect bite, or even existing eczema. Now get this number, 70%. That's the huge chunk of impetigo cases classified as the non-bullous type. We'll visualize what that means in a second, but hold on to that stat. This 70% majority targets kids between the ages of 2 and 5. It spreads like wildfire in daycares because, let's be real, toddlers aren't exactly known for their rigorous hand-washing routines. Moving right along to section 2, điểm mặt vi khuẩn gây bệnh. It's time for the lineup. Who are our suspects? We're looking at 2 major pathogens here, Streptococcus pyogenes and Staphylococcus aureus. Historically, strep was the main offender, but actually, scratch that. Staphylococcus aureus has totally taken the lead now. It's found in up to 60% of non-bullous cases. But here is the real kicker. When it comes to the bullous type, the one with the large blisters, Staph aureus is completely acting alone. Why? Because this specific bacterium produces a nasty little toxin called exfoliatin. This toxin acts like microscopic chemical scissors, literally cutting the connections between the upper skin cells, which causes the skin to separate and blister. It is a fascinating, if a little terrifying, biological trick. Okay, section 3, dấu hiệu nhận biết bệnh. We know the suspects, now let's look at the actual evidence. We basically have 2 main clinical presentations that we need to pit against each other. On one side, we've got non-bullous impetigo, which, as we just learned, is the heavy hitter at 70% of cases. On the flip side, we have bullous impetigo, characterized by large, fluid-filled sacs. They look completely different, they progress differently, and they even target slightly different age groups. Looking at a textbook presentation of the non-bullous type, the progression is incredibly fast. It usually kicks off as a tiny, flat red spot, a macule. Then, very quickly, it pops up into a small, fluid-filled bump before bursting open. The ultimate hallmark here, the dead giveaway doctors look for, are these signature thick, honey-colored crusts. It literally looks like yellowish-brown honey dried on the skin. When those crusts finally fall off, they leave a red, moist patch. But the good news? They heal up entirely without leaving a scar. Now contrast that with the bullous form. Remember that exfoliating toxin we just talked about? This is its handiwork right here. These are large, thin-roofed, flaccid blisters that can balloon up to 3 centimeters across. At first, they're filled with clear fluid, but in just a few days, that turns cloudy and dark yellow. Because the top skin layer is just so thin, they rupture super easily, leaving a moist red circle with a rim of crust. And while the non-bullous type hits those fast-moving toddlers, this bullous form predominantly strikes infants and newborns under 2 years old. But a good medical detective knows that looks can totally be deceiving. Doctors have to carefully rule out some really tricky lookalikes to get the diagnosis right. They have to tell it apart from herpes, which normally shows up as grouped, painful little blisters, or chickenpox, which beautifully but terribly looks like a dewdrop on a rose petal, scattered everywhere. They've also got to rule out severe eczema flare-ups, fungal infections with those clear, scaly borders, and zoster, or shingles, which tracks along a nerve path and is incredibly painful. Pinpointing exactly what we're dealing with is absolutely crucial for treating it right.
Section 4. Các biến chứng miền.
You might be sitting there thinking, hey, it's just a little skin rash, right? No way. We cannot take Impetigo lightly because these bacteria can trigger some serious secondary issues. The most alarming complication, acute glomerulonephritis. This is a sudden, severe inflammation of the kidneys. It typically hits about 2 weeks after a streptococcal Impetigo infection, mostly in kids around 6 to 10 years old. Basically, the immune system gets totally confused and attacks the kidneys, leading to facial swelling and high blood pressure. Other scary complications happen if the infection dives deeper into the skin layers to cause cellulitis, or worse, enters the bloodstream, resulting in life-threatening sepsis. Which brings us to our final stop, Section 5, điều trị và phòng ngừa. So, how do we actually stop this? Medical science has a very clear, structured protocol, usually wrapping up in 7 to 10 days. The primary step is local wound care. Patients gently soak the spots with super diluted antiseptic solutions, like potassium permanganate, to clean things up and soften the crusts. Once that's done, topical antibiotics like fusidic acid or mupirocin are rubbed right onto the site to kill the bacteria directly. But if the lesions are everywhere or if the patient spikes a fever, doctors will bring in the heavy artillery, oral systemic antibiotics like cephalexin or amoxicillin clavulanic acid. But honestly, medicine alone just isn't enough. We have to break the chain of infection. This is the strict, non-negotiable hygiene protocol for any household or classroom dealing with this. Step 1. Literally do not scratch. Scratching just relocates the bacteria. Step 2. Every single day, wash and iron the infected person's towels and clothes completely separate from everyone else's. Step 3. Keep those fingernails clipped super short and wash hands like a pro. And step 4, this is a total game changer for public health. Keep infected kids home from school until they've been actively taking their oral antibiotics for at least 48 hours. So here's the thought to leave you with today. Are we doing enough to break the chain of infection in our own schools and homes? Impetigo is incredibly contagious, and it genuinely carries the risk of severe complications. But the real power to stop it doesn't just sit on a doctor's prescription pad. It's in our daily habits. Simple, diligent hygiene and getting timely medical care are absolutely our best defenses against this microscopic invader. Keep those hands washed, stay vigilant, and always stay curious. Thank you so much for joining me on this explainer, and I really hope you leave today feeling empowered to crack the case on Impetigo.